नमस्कार सबैजनालाई मेरो नाम कमल आर्याल NDA-Uk को president. This is my great pleasure to start this meeting. So I would like to ask my colleague, Dr. Ashish Shrestha, Mr. Ashish Shrestha actually, who is consultant colorectal and general surgeon at William Harvey Hospital in Kent. He will be conducting this program. I'm very thankful to all the speakers, the panel members, the NDA-Uk members, and all the delegates who are able to be here today. I'm myself looking forward to it, and I hope this will be a very useful session. When we are doing it, please make sure you are muted so that there is no echo. If you have got any questions, please raise your hand or put those questions on the chat box. Between each speaker, we'll try to make some time so that you are able to ask some questions. And also we would encourage everybody to put their camera on, so that makes it a bit more lively, I think, for the speakers and for everybody. It will be nice to have a feeling that you are talking to each other. So with that, Ashish, all is yours. Thank you, Ashish, and everybody here.
Thank you, Kamal Rai. I'll share my screen. I'll just like to share the program first. But before I start, I would like to thank Kamal Rai and Bishwa, who is there. And we have been running this webinars for quite a while. And this is the third part of our running this program. And the first one was about PLAB. The second was one about PLAB and beyond. And now this is about GP training and applying for specialist registration through non-trade grading. Now, before we start, Kamal Rai has set the ground rules. Please do send the question in the chat box, unmute yourself. We'll have plenty of time for discussion later on. And we got nearly 172 registration, but hopefully we'll have at least 50 today. People might be busy. It's Saturday in Nepal. But yes, do send your questions. We'll send a link at the end. We'll send you all the contact details at the end. To start with, we have Jolisha, and then it will be followed by Tulsi. Sujata was the one who helped us to organize this event through the registration form and to help us to create this poster. She's not here today because she's on call, and we have Anang, Pangeni, and myself at the end. And probably around 11:40, 12 o'clock, we'll have a discussion session. Now, to start with, I would like to introduce Jolisha, who will be talking about life as GP in UK. She did her MBBS in Kathmandu Medical University, and recently passed out her GP, and she's a working GP in Kent. Jolisha, do you want to? Shall we start, Jolisha?
Hi there. Good morning to everybody. Namaste. I am Dr. Jolisha Singh. I am a recently qualified GP, and currently I'm working in Kent. Kent is southeast of England. First of all, I would like to thank everybody, especially in Nepal, who have separated their weekend time to come here and join us in this webinar. Thank you. Next, please. So what is a GP? I think that's the first important question to answer, because I know that the definition of GP is very different in Nepal. So this is something I've literally taken from the NHS website. The definition of a GP is a GP or a general practitioner is somebody who treats all common medical conditions and refer patients to hospital and other medical services for urgent and specialist treatment. They focus on the health of the whole person, combining physical and psychological and social aspect of care. I would like you to focus this paragraph in two ways, or in two parts if you can. The first part, I think, is something which we all do as doctors. We triage patient, The difference between a GP and a specialist is supposedly a patient comes to me, for example, a patient with heart failure. I would try to put them on 2-3 antihypertensives. When it's getting to the fourth one, I would think, okay, this needs something that a cardiologist would be better equipped to do. And that's when I refer the patient to the hospital. Or something similar, if I think somebody has acute appendicitis, I, as a GP, will be working in a clinic setting. So in Nepal, just like you work in your OPD setting, that is a general setting in which a GP would be working in. And because I'm not skilled enough to do a surgery, I will be referring to the secondary care, which is the hospital. And the second part is even more important, I think, to understand what is the difference between a GP and a specialist. When you are working in a hospital environment, I think you are almost disconnected to disconnect a patient, and you don't recognize a person in a patient, if that makes sense to you. So you are just really focused on the medical ailment. The important job of a GP is to recognize a patient as a person and to form a really important bond, which is going to be lifelong. In the UK, as a GP, you would not only be treating care of their medical ailments, but you would be treating their mental health, their if they have any substance abuse, sometimes even their financial woes. And I know if you're from Nepal, it is a bit difficult to fathom, like, how does that system work? But I just thought it is important that you know that there is a different world out here where, as a doctor, you would be seeing lots of different areas of a patient's life besides just medical. Next. I think it's, again, really important to differentiate between the working life of a GP in Nepal and the UK. From what I gather, the working environment of a GP or MD-GP in Nepal is in the A&E department, or what we call as accident and emergency. In the UK, we work in a clinical setting. As I mentioned, that is where you sit in an OPD room. You will have certain instruments, like you will have your own ophthalmoscope, otoscope. As I said, you'll be seeing everything under the sun. But if it is something important or something that needs a more urgent care, you will send it to the secondary care or the hospital. The next important difference I found out was that in Nepal, most of the GPs have to do night shifts. It's almost mandatory for them. And that is not the case here in the UK. Night shifts is like totally, it's optional, and so is the weekends. The next. So I would like to say something about my past, because I think it reflects upon the decision I made to become a GP. So this photo was taken circa, I think, 2014-15. I had literally walked out of taking my PLAB exams on this particular day, and my other doctor friend Poonam had taken this photo. Was really happy here because I was happy. I knew I would pass this exam. I was excited to work as a doctor in the West, the UK. I knew there was a really hard task for me, because that's a big ask for you. All of a sudden, you are changing the way you practice. I was talking to a lot of friends who are doctors working here before me, because I think important knowledge and information is knowledge. And I would just advise everybody that if you are planning to come to UK and work, you have to be ready to work hard, because the learning curve is very straight here. Thank you. Next. I would like to just touch base upon the challenges I faced when I worked here initially as a doctor. First of all, everything is computerized, which is very different from Nepal. So you have to also be really careful about how you document your things. And these are the different things we don't really focus on as a doctor in Nepal. We just scribble the signs and symptoms and we write the diagnoses, and that's pretty much it. It is a whole lot more elaborate here. That was new for me. Culture adjustment, of course, when you're in Nepal, you don't really cross-question your seniors. You leave your questions unanswered, or you're too scared to. So it was a very refreshing change, and I was fascinated to see all the junior doctors asking their seniors, but why did you make that decision? Why not A? Why B? So it took time for me to really come out of my shell and question my seniors. So that was a bit of a cultural adjustment for me. Of course, the other adjustment is how you talk to the patients. As I mentioned here, there's a very close relationship between the doctor and the patient. You really listen to them, you really respect their opinion, and that took some time. The other bits and bobs were documentation, importance of respecting somebody's privacy, etc. Next. So this was my last day working as a surgical SHO in William Harvey Hospital, and I was very happy this day because I made a decision that I wanted to be a GP, mostly because I did not want to do night shifts my whole life. I wanted to have a very good work-life balance. I think it's important to live as a person as well. So it was actually my surgical registrar who convinced me, you know what, Jolisha, you're such a good talker. I think you should be a GP and you don't have to do night shifts. And I was like, really? So that is all I knew. And then later I discovered GP training is also just 3 years. If you want to specialize supposedly in ENT or medicine, it's roughly 7 to 8 years. So to me, those were the initial to go to. Of course, I had been practicing medicine, but I was very happy that day. No more standing for 4 hours for an anterior or posterior resection with Ashish in the hospital. Next. So GP training, I think, again, it's important to know that when you do training here, you will get lots of opportunity to also enjoy life, but also you will get to learn a lot of stuff. The training itself is for 3 years. It is grueling. You will learn a lot. You will be posted in different parts of the hospital with different departments, because as a GP, as I mentioned, you will be seeing everything under the sun. So they will give you a chunk of 3 months posting in pediatrics or gynecology or stroke or medicine. It will be a bit like a raffle. You will get a bit of some, but not everything. But you'll also get lots of leave. Enough to take a break in between. So I did travel a lot during my my training time, and but I also made a lot of friends, and I also learned medicine in a whole different way. It was very evidence-based. It was very up-to-date. Medicine is fluid, medicine is dynamic, and it's really exciting to practice those changes as it happens. Next. So I've passed as a GP now. We need to take 2 exams, which is really going to be something that's going to test you to the core. Trust me, after passing the exams, what is it being a GP? I would like to start by saying is everybody can choose their own way of working, and that is the beauty of GP. So the general day is when you'll see a patient list, like supposedly if you work in an OPD, you get your list of patients. It will be something very similar, but it would be everything from you'll be seeing somebody's ears, to next patient would need some sexual health advice, to the next patient would be feeling suicidal, to a 4th patient who you think might have an ongoing acute coronary syndrome and you need to refer the patient to the hospital. So the wavelength in which a GP has to work is just unparalleled, I think. And I think this is also my personal take on what allures me to GP land immensely now, because no same case comes to you within a span of the same day. So you're always fresh and you're looking at new things. Some things which we GPs have to do, which is a bit different to people in Nepal, the whole concept is home visits. There are a lot of elderly patients, probably there in Nepal as well, who are too weak to come to the GP, or there might be some cancer patients who are not fit to come to the surgery. These are the patients who needs a doctor to go to them. So you go to the patient's house, you do the medical evaluation, and you manage accordingly. Duty day is just like on calls. That is when you see all the acute cases, sometimes take care of medical management. Like, for example, somebody needs a high dose controlled drug. You would know, like, you need to know why they want it, or somebody might need some urgent care with their ulcerative colitis. So lots of urgent medical cases is what you'll be doing on the duty day. Admin work is what we cool kids call it. It's just a full form of administration day. That is usually when, if you remember, I said you will be referring some super specialization needed cases. So the specialist, for example, cardiologist, will now write you a letter saying, okay, so the fourth antihypertensive drug, which is best for this patient, is so and so. Or you would be requesting some ultrasound as a GP, or you'll be doing some blood test. So dedicated time would be given to you to go through these administration works and paperworks. And that is what entails almost like a ready-made template of a normal GP here in England. Next. Normal day for me. So as mentioned, you can negotiate how you want to work. So if you are somebody who's planning to start a family, for a female, or who would want to do something else in life, you can actually choose how many days you want to work. The best thing is no 2 days are the same. As I mentioned, medical is vast, and you will see literally everything from a patient with an EVAR to a patient who has just had some most recent ongoing drug trial. So it's very exciting. Every day is a learning opportunity. British culture is very different. So you learn new slangs, you learn new cultures, you learn new customs. It's beautiful, I think. And I couldn't stress more on how much wholesome of a doctor you're going to be if you will be a GP. Next. Career choices, touched on this already. So full-time salaried GP, they would be working 4 to 5 days a week. Part-time salaried, someone like me, you can work 2 to 3 days a week. That's absolutely fine. Partner is a concept where there are doctors who are quite good businessmen as well, and they might be interested to invest something in future. So if you have qualification as a GP, you also have this separate avenue where you can invest some money on that GP surgery or practice, and just have your financial gains, really. Locum is just a freelance doctor, so you are not really working under someone. So you can send your CV to 10 different clinics and say, I want to work for you on that particular day. They will hire you and pay you as per the days or the hours you work. Gypsy is a very attractive aspect of being a GP here. So I know some of you ask questions, but what if I want to go further in life? What if I want to, for example, have an additional qualification of maybe geriatrics or ENT or dermatology? Absolutely. You do have a choice to further your horizons as a doctor. And the best thing about it is the training program will pay you to do it. Again, which is very different from Nepal, because when I asked my friend, she said she would have to pay extra to get that extra degree. That's just in a nutshell. Thank you. Next. So one more time, GP life, I've discovered there's no dearth of jobs here. When I passed, I literally got a call within 6 hours of when do you want to come to work? So तपाईँहरूलाई लाग्छ कि मैले GP पास गरेँ भने मलाई जब पाउन गाह्रो हुन्छ कि अथवा I want to settle in certain parts of England, मैले जब पाउँदिन कि I assure you that there is just high demand for GPs, and you will not struggle to find a job in the area that you like. Work-life balance, it's brilliant. I get to sleep knowing no bleep is going to go off. I'm not going to be called to do some complicated surgery at 3 a.m. in the morning. That's I think priceless. I can still go to my gym when I want. I can do extra activities, meet up with my friends. It's brilliant. Skills development, as a GP, you will be seeing everything under the sun. It's just amazing that you can have a conversation with any doctor of any field, especially if you're in Nepal. Koseko ghura dukcha, koseko mutuko problem huncha, koseko akhako problem huncha. They come and ask you, and as a GP, nothing will faze you. You would know more or less what the issue is. And I think that is a real stark difference in this world of super specialization, where you tend to really forget the overall body. And in that way, GP is brilliant. Couldn't stress this enough. Patient-doctor relationship, especially if you do come to West, and if you're a GP, tapaile same patient, you will know him or her and his family or her family through the years. You're going to have this beautiful relationship of trust with them. No 2 days are the same. You don't know what's going to walk through that door, which makes it beautiful. Gainful, as in it's going to pay you more. It's going to be a fortuitous profession for you. I know money should not be the driving factor, but you cannot deny it is one of the important factors in life, unfortunately. And of course, there are lots of other avenues you can pursue should you want to. Thank you very much. Next. Right. So I had other Ashish, sorry.
Okay, questions. Do you want to answer the question that the people asked before, or yeah, you can do that?
Yeah, I think I would just pick on the ones which I could answer a bit more confidently. Somebody asked, if you already have a master's degree in one specialty, what is the pathway for changing into other specialty or getting GPST? Is it possible? So getting into the program, I think Tulsi will get into it in more detail, but the short answer is yes, absolutely. And as mentioned, Tulsi will say it more in detail. Is it right for me to select, next question, as a place for my PG training as well as for earning lump sum of money? Again, short answer is yes, lump sum of money, definitely. Or else, I mean, just look at my traveling photos. If I was doing this in Nepal, there is no way I could afford to travel and work at the same time. But more importantly, you will see a different way of practicing as a doctor in England. When I was working in Nepal, I have to confess, there were very few doctors who really encouraged me to have empathy and to really see a patient as a person and not differentiate the way you treat them based on their social status and the amount of bank balance they have. That's an important lesson. I just really experienced that culture here. The next possible is, the next question is it possible to join UK after we finish MDGP program? Yes, it is. And is MDGP programs in Nepal recognized elsewhere? I know it might be recognized in some part of Southeast Asia with some hoops you have to jump through, but I'm not sure it's really recognized here in the UK. That's all the questions I can answer from here. Thank you.
Thank you, Jolisha. That was really well done. Okay. With regards to MDGP, the degree is not recognized, but the experience they have might be helpful in application for CESR. Okay, they can also, there's another route of coming to GP. One is through the training route and through the CESR route. I'll be briefly talking about it anyway. So Jolie said that was a really excellent presentation. Okay, looks like you're going to, I think I need to be a GP now. So that I don't have to do nights and so on. That was really well done. Now I'll give the floor to Tulsi.
I should say just a quick one, if I may add a few things. Yes. Okay. So that was a wonderful presentation. Thank you so much, Jolisha. As a surgical trainee, I just want to add a few bits because, sorry about the background noise. we work very closely with GPs and with the referrals and everything we get from the GPs. And I just want to take this opportunity to thank you for making everyone's life so easier. Because of your instinct and judgment, things are easier, and I think patient get the right treatment at right time. Thank you. Just that.
Yeah, and GP has all the money with them, so they can have enough money. They give money to the hospital, so GP has all the funding, health funding, most of that. Okay, Tulsi, she is Dr. Tulsi Poon, and she did her MBBS from Dhaka University. There are people on the floor in the platform who is from Dhaka University, which is good. And I've seen quite a few people, my colleagues, my juniors, and people who have done MBBS from my college. So I'll welcome Tulsi. Do you want to share the screen now?
Thank you, Ashish. Let me share my screen first. Okay, everyone can see my screen?
Yeah, Tulsi.
Okay, thank you so much. Namaste and good morning, everyone in UK, and good afternoon to everyone who joined from Nepal. Thank you for joining today, and I'd like to thank NDA-Uk and Kamal Dai and Ashish for giving me this opportunity to help my colleagues or my friends back in Nepal and over here who wants to pursue career in GP training. My name is Dr. Tulsi Poon. I'm the GPST3 currently in East Kent Deanery, and my dear friend Sujata Rai, unfortunately, is not here today. She is ST1 in the same trust. So we worked together to prepare this presentation because we went through two different pathways. I'll explain you later. That's why we came together and prepared this presentation. So let me start the presentation. Basically, this presentation is about, Jolisha has already talked a lot about GP itself and life as a GP and opportunities. I'm not going to explain or go into too much detail. I'm just focusing on the application process, the GP training application process. If you're convinced with whatever Jolisha has said already, then you might be interested in applying. So I'll give you some rough idea or knowledge how to apply for the GP training.
Tulsi, do you want to go on a slide slow?
Yeah. Okay. So basically, today's presentation is about overview of GP training and the application process I've mentioned, and I will briefly talk about the entry exam, which is called as the multi-specialty recruitment exam or assessment, and then the common question frequently asked. So why choose GP? I don't have to say anything more about it because Jolisha has already explained so beautifully with all those lovely pictures. Hopefully you are now a bit convinced being a GP. So obviously GP, general practitioner, what they call in USA, it's family doctor. We are the first port of contact. Of course, we have the continuity of care. And of course, the flexibility, working as a GP, you are the boss of yourself. Jolisha has already mentioned about it. You can work anytime, any shift, like all mornings of the week or 2 days a week. You don't have to do weekends, nights if you don't want to, but you can work as extra as an out-of-hours GP, and compared to other specialties, it's a short training pathway. It's either 3 or 4 years, and of course the wide range of practice or role beyond the GP or general practice, which Jolisha has already mentioned. So these are the few things why I chose GP. Not limited to this, and we can't stress enough the holistic approach of GP, which Jolisha already mentions he faces every day. So let's talk about the GP training itself, like basic knowledge about the training. So it's normally 3 years as a trainee, as a GP trainee in most part of the UK, but some part of the UK, like Scotland, they offer the 4 years training as well. And usually within that 3 years, you spend half of your training in the hospital, mainly in your ST1 and ST2, and half in the general practice. But they are in the future trying to work on like maybe 1 year in hospital rotation and 2 years in general practice, which makes more sense. But still, most of the trusts are still following the half-half rotation. And throughout your 3 years rotation, you'll have one educational supervisor who is your main trainer, and you'll have different clinical supervisor depending on your rotation. If you're in hospital, the hospital consultant will be a clinical supervisor who will be supervising you in that rotation. But still, you'll be in touch continuously with your educational supervisor. Your portfolios, your log entries, will everything go to your educational supervisor. And every 6 months, there will be a review with your educational supervisor to look into your portfolio and how you are progressing. And then at the end of the year, you'll have an ARCP, which is called as the Annual Review of Competencies Progression, which you have to pass every year. And during the training itself, you'll have to sit for the MRCGP exam, which is 2 parts. The first part is AKT, Applied Knowledge Test, which you can sit from ST2 and above. And the second part, which is more of a practical CSA or RCA currently in this COVID scenario, you sit in the ST3. And you have to pass this 2 exams within the training period. And once you pass the exam and you finish your training, then you'll get the CCT to work as a GP. Unfortunately, if you don't pass the exam, then the training may be extended depending on your situation. So when I came to UK first, when I was planning for the UK journey, I was confused about different roles in UK, which is not commonly heard or seen back home. So I just want to give you a brief idea about the comparison between different roles in Nepal and UK. So once you know, they pass MBBS over here, and the UK graduates, let's say, they go into 2 years of foundation training program. The first year, which is called as the foundation year 1, is similar to internship, what we do back home. They have the provisional license to practice from GMC. And once they finish the foundation year 1 and they complete all the assessment, then they progress to foundation year 2. And they get the full registration or full license to practice. And the foundation year 2 doctors, compared back home, is similar to medical officer's job. So you may see advertisement like trust grade F2, SHO, senior house officer, or ST1 trust grade. All those roles are similar to medical officer. And they share the same rota and share the same job. It's just the foundation year 2, they are in the training phase, in the training of the second year of the foundation program. And you may be expected a bit more if you are working as a SHO or ST1 trust grade, thinking that you have already passed the phase of foundation year 2, but the rota and the job role is pretty much similar. And then the registrar and consultant is almost same back home and over here. So now let's go to the GP training application process itself. So the eligibility criteria or the prerequisites is, of course, first of all, you have to have an MBBS degree or equivalent, and you should have at least 2 years of clinical experience by the time the training starts. The internship will count within that 2 years, and then 1 year you can work in any department anywhere in the country, in UK or back home as well. Those 2 years will count to the clinical experience. And let me make you aware, getting GP training job will not give you GMC license. So you'll have to have a GMC license, full GMC license to practice in UK by the time you intend to start the training. So you have to go either through other routes like the PLAB route or the post-graduation route, whichever is suited for you. And the important bits of the application process is these 2 certificates. You'll have to have a foundation year 2 competency. We'll discuss more about in detail about this. And then the advanced life certificate. And the number 6 UK driving license is not mandatory, but it is something you have to declare during the application process. When you apply through ORIAL, they will ask you whether you have a UK driving license. It's not mandatory, but you have to declare. If you don't have license, then you will have to arrange your own transport or public transport or private transport during the training process if requires. Because as Jolisha has already mentioned, we have to do lots of home visits. So it's quite handy if you have a driving license and your own car, because time is so precious during the working time, and you are hectic. Your patient comes every 10 minutes or so, and you have limited time for a home visit as well. So a driving license is pretty much must or quite useful if you have. Now let's talk about the F2 competency, and which is one of the most common queries people have about this competency form. So applying for any specialty, whether GP or any other specialty, you will have to have this competency form. You can get this through 2 pathways. Option 1 is through the foundation year 2 pathway, foundation program pathway, and the other one is the CREST, Certificate of Readiness to Enter Specialty Training pathway. So personally, myself, I went through the option 1 F2 pathway, and my friend Sujata, she went through the CREST pathway, and we will talk in detail about this. Now, getting F2 competency via F2 pathway. So you can get this competency form signed off if you get any foundation training in the UK itself. So foundation training, there are 2 ways you can get. Either you do a full foundation training program, which is not usually common for IMGs because they have already done internship back home. And if you have done the internship, you cannot apply for the full foundation training program. And like me, if you've done the internship back home and came to UK and worked as a trust grade for a few months, and then you can apply, if you're interested, you can apply for a standalone F2 training, which usually people haven't heard about it. But I had, when I started in William Harvey, Ashish, and there were a few of the registrar who helped me go into this route, and which I found really useful because it is a training junior job, foundation year 2 job, and it is run by the UK Foundation Program. And there is a separate, application process and eligibility criteria for the standalone F2 training. And most of the IMGs, as I said, they go through this pathway if they want to do a F2 competency by F2 or training job. They go to a standalone F2 training. And once you complete the training, then you get, once you pass the ARCB, you get the F2 competency form, which you can apply for any other specialty. And like I mentioned, they may advertise F2 trust grade job, but that's not the training job. That's a trust grade job, and that won't fulfill the F2 competency form or ARCP as a trust grade job. And in that case, you have to go through the CREST pathway. Now, through the CREST pathway itself, so you can get it by two ways. We'll talk in detail about the CREST itself later, but it is a kind of a form which can be signed by the consultant. So for the first one, you can sign it over here in UK. You work as a trust grade or non-training doctor in the UK for a few months, and then a consultant can sign it. And the option 2 is you can get it signed by the overseas consultant, which as immigrants or let's say IMGs, they don't usually prefer this one because there are a few of the points in the CREST form itself, which we normally don't see back home. And it is quite tricky if the consultant signs that off, like the do not resuscitation form. I've never heard when I was practicing or doing internship back in Bangladesh. So it was the first time in UK I saw this red form, the do not resuscitation form. And it it is one of the criteria, or let's say the competencies to be signed off in the CREST. So it's quite tricky, but still you can get signed off back home if you have some exposure about it. You can work as a medical officer over there, and the consultant can sign it if they are happy. But you have to work under that consultant within the last 3.5 years for at least 3 continuous months before signing that CREST form. Now let's talk about the CREST form itself. So it is quite a long form, about 10 to 11, and there is quite a good information given in the first page itself about this form and how you sign it. So as I told you, it is signed by a consultant or equivalent, and you should have worked with the consultant at least for 3 months at least for continuous 3 months within the 3.5 years prior to the advertised post-start date for which you are applying. And if your consultant or the signatory is registered with any medical regulatory authority other than the GMC, then they should make sure that they submit their current evidence of their registration with that authority. And previous or historic registration with the GMC will not be accepted. And if you fail to provide any evidence, then the application will be rejected. And you should not use a signatory with whom you have a close personal relationship. And the consultant who is signing must demonstrate that each and every professional capability on the certificate. If they tick unable to confirm in any of the competencies, then the CREST form will be rejected and you may not be able to apply for the training. Okay, this is a part of the CREST form. This is only 1 page, so you can see this is section 3, and there are quite a few competencies over here on the left side, and this is how they tick and sign the form. And the last column, unable to confirm, make sure none of the competencies are ticked over here. You have to have either green one or the amber one to be accepted. And please do not make any false declaration in the CREST form. If they find out any false declaration, then it will lead to various things like referring to GMC, withdrawing the training post itself or the offer, and the consultant who signed it, their license may be in jeopardy, and of course it will show bad impression and reputation for IMGs. Now, the next certificate that's needed for applying GP training is, of course, the Advanced Life Support Certificate. This is run usually by the Resuscitation Council UK or equivalent, and you should have the certificate before the intended start date. So when you apply for the training, you may not have the certificate. You can give the date, or you can give the certificate later before the start date of the training once you get the offer. And it's usually either a 1-day course or the 2-day course, but I would advise you to attend a 2-day course, which is more useful, and you'll get more practice and be more confident. It's usually, if you are in training job like the F2 training, the deanery will cover the study budget for the course. But if you are in non-training job, it depends on the deanery or the trust. They may cover or they may not cover. If they not cover, then you might have to pay from your pocket. If you do usually from your trust or hospital, cost roughly about 250, and if you do outside or through different trusts, then may cost about over 600. It depends. And once you're done with the ALS, it's usually valid for 4 years, and it's only needed for the application process. Once you enter into GP training, and if your ALS expires, you don't need to do ALS again. You just need the BLS yearly, basic life support, which is more easier and cheaper. And even if you're training, the trust will cover for BLS as well. Okay, so this is just the basic idea of the application process this year. So the round one is currently going on, the application process. The training will, usually most of the training or specialty, they start from the August of the year. So this year, GP training will start August 2022. The application opened in November, and the entry exam, the MSRA, started in January, just recently finished. And the job offer will go from the March. And there is another round two, which normally starts in February. Those seats or vacancies or the training posts which are left from round one are fulfilled in the round two. And this is the basic idea of the window opening. It varies, so you have to look into the GPNRO website for the dates and timeline for every year. So it takes quite some time to prepare all these, the CREST form, the ALS, and all the application process through. So make sure that you prepare a year ahead and start collecting evidence. If you are thinking to apply for next year, you might start it straight away today. Okay, once you collect all the evidence and once the application window opens, so it's the ORIEL where you have to go into and create an account. For most of the specialties, we apply through this ORIEL for the training process. And you apply for the GP training, you can upload the CREST form if you have, or the F2 competency if you have already completed your F2 training. If you're still on your training and you are applying for GP training, you don't need to upload the certificate at that point. You just have to mention that you are doing F2 under Foundation UK, and then it will give you an option not to upload. And then, of course, your ALS certificate. And then once your documents are checked and you are eligible, then they will long list, as in like they will invite for the entry exam, which is called as the MSRA exam. And you can also list the areas of preference where you want to work or where you want to train, which can be modified later once you get the offer as well. And we'll talk a bit about the MSRA later. Then the next step is the exam. And once you pass the exam with a sufficient score, so because of the COVID, there are a few changes. I will explain in detail later. But currently, the ranking or the offers are based solely on the MSRA. But before, there were like, if you pass the MSRA and if your score is quite high, then you get a direct offer. And if you don't get this high score, then you'll be offered for a interview, which is called as the third stage of the training application process. And we'll talk about it later. And once you pass the MSRA and the interview, then the score will be tallied and ranking will be released, and be also offered the post depending on your area of preference and your rank. And once you accept the offer, then you'll have to provide 3 references. So this is just the overview of the training application process, GP training application process. So first one is obviously application, long listing, and then you sit for the entry exam MSRA. And currently there is no interview, so they just rank or give score based on the MSRA and offer the jobs. And then the pre-employment checks, which include the 3 references, as I mentioned earlier, that the occupational health, DVS, and if you need a visa, then a certificate of sponsorship. So let's talk briefly about the MSRA, the entry exam. So if you're planning for GP training, then it might be beneficial knowing what it is or what MSRA and how you want to prepare for future. So it's basically a computer-based exam. It's a multi-specialty recruitment assessment. So that means not only general practice, there are a few other specialties that use the MSRA score, including psychiatry, radiology, ophthalmology, obs and gynae, community and sexual reproductive health, and neurosurgery. And in the same sitting of the exam, the same score will be valid for all the specialties if you want to apply. Like for me, I applied for both general practice and obs and gynae. The same score was valid for both of them, but finally I chose to go into general practice for so many reasons, like we already mentioned. So if you are interested and not sure at the moment whether to go into general practice or something else, or even between psychiatry or let's say ONG, you can apply into few specialties together with the same exam. And this exam mainly consists of two parts. The first part is professional dilemma paper, and the second one is clinical. So let's talk about professional dilemma paper, which is called as the situational judgment test. This is not a test of the clinical knowledge, rather it's the assessment of the candidate, how they approach as a doctor, how they work as a doctor. So they will be given scenarios in a workplace where they can demonstrate their judgment about the most appropriate behaviors in that context, especially when they are posed with high challenging professional dilemmas. And it directly relates to the generic professional capabilities framework outlined by the GMC. And good website to refer to is the Good Medical Practice of the GMC. And as I told you, it's not the test of the knowledge, but if you have worked in the hospital setting or the NHS, then it will be quite useful to answer those dilemmas questions. And it mainly covers the three core domains of the GMC. That's professional integrity, coping with pressure, empathy, and sensitivity. So looking into the domains, you can see it's not a test of the clinical knowledge. And there are about 50 questions, about 95 minutes. And after you finish the professional dilemma paper, you may get a 5-minute break. That's not mandatory as well. If you don't want, you can directly go into the clinical solving paper. So clinical solving paper, the name itself, it's the test of the clinical knowledge and how you apply that knowledge in your everyday practice. And the questions are based made in such a way that the foundation level doctor can answer. It's not a difficult question like for the registrar or the consultant level. It's just the basic SHO level. And it's not just the recall of the medical knowledge, it's the way how you apply it in your daily practice. And so it can be quite tricky as well, because it's not just a recall one. You have to apply how you apply in that situation or in that scenario. And it basically consists of 97 questions, about 75 minutes. So you can see it's quite time pressured exam. So you get about roughly, let's say 46, 47 seconds per question, which is quite tricky as well. Under pressure, you may, answer even the answer, you may take it to the wrong one because of the time pressure, so quite tricky. And this exam is not negatively marked, so make sure that you answer all the questions. And once you pass the MSRA, previously pre-COVID, we had to go through the stage 3 application process, or let's say the interview, if you haven't got the exceptional score. Currently this year and last year, the stage 3 was scrapped due to COVID, but it might come in near future, next year or so, if the COVID settles. So I just want to give you a brief overview of this stage. So it is not a typical interview like the other specialty where you have to face the examiner or a panel face to face and question answer round or check the portfolio. It's not like that. So for the GP application process, the stage 3 is another assessment, and there are 2 phases. The first one is the written prioritization exercise, which is about 30 minutes. And it is roughly talking about, it's about like a situational judgment test, but you have to write why you are choosing that over another. And it will I think there were about 5 or 6 questions in that 30 minutes. Each will get about 5 minutes or so. And once you finish that, there is a simulated consultation. And each there are 3 scenarios, and each will last about 10 minutes. One is with a patient, one is with a relative, carer, or family member, and one with a colleague. May not necessarily be a doctor, could be a nurse, receptionist, physiotherapist, anyone. And the simulated consultation is also not testing your clinical knowledge, rather it's testing your consultation skill, which you need as a GP, of course. So this is just the overview of the application process. So you apply via Oriel, then once longlisted, then invited for the exam, MSRA. So if you get a score of more than 575, that was pre-COVID and may come as post-COVID as well. If your score is over 575, then you will directly get an offer without going through the stage 3. And if you pass the MSRA and a normal scores, then you go through stage 3, and they will calculate all the scores together and give you ranking and then the offer. And if you fail any part of the exam, then you have to reapply for the next round, unfortunately. And even if you pass, you may not get the offer depending where you have applied for. And in that case, if you don't get any offer, then unfortunately you have to sit for another round as well. So this is just the overview of the application again. And these are the important websites where we gathered all this information, or where you can read more about it. The main one is the GP National Recruitment Office website. So you can get all the applicant guidance for every year, and also get some information about the exam itself, the MSRA. And there are some sample questions as well you can do. And the CREST form link, you can download easily from Google. The latest one is CREST form 2021. And you can have a look what evidence you need and start working on that as well. And this is the Oriel website where you apply for any of the training in UK. Okay, so let's end with some of the questions the participants have asked in the pre-questionnaire. And I think a few of the questions have already been answered by Jolisha. I'll see which one I can answer. Sitting MRCGP before training. So MRCGP is the exam which you have to sit during your training as a GP trainee in UK. Unfortunately, you can't sit the exam before the training starts. Like the other exam, like MRCP, MRCS, you can sit or prepare beforehand and pass the exam before joining the training. But MRCGP, you have to pass within the training in the UK. Then applying for GP training without non-training job in UK, that is possible, but it's something that we wouldn't recommend much. As I told you, CREST form can be signed from back home, and if you get the ALS certificate while doing FLAB, when you came for flag exam, you can easily sit for ALS course, and then you can apply for GP training. That's not a problem. But the main problem is, like Jolisha has already mentioned, the system, the NHS system, and the the way we practice over here is totally different from back home. And if you directly start your first job in UK as a trainee doctor, then it might be quite difficult for you to adjust. You are new to the country, you are trying to adjust your home life, your personal life, at the same time professional life. Can be quite overwhelming. And if you start as a non-training doctor, you are given shadowing period. They will consider your on-calls. They may not give you on-call for the first few weeks, and all those sort of adjustment, or you can get through non-training job. But unfortunately, in the training job, you have to go like straight into the battlefield, and nobody would consider anything. So I wouldn't recommend starting, any training job as a first job in UK. And the next question is it possible to join UK after we finish the MDGP program? I think part of it, Jolisha has already mentioned. MDGP is not valid over here, and you can't work as a independent GP, as far as I know, if you have MDGP. There may be another route which Ashish was talking about, but it is quite difficult, and you have to start with the scratch, like through getting GMC registration and applying for GP training. And the next question, if you already have a master's degree in one specialty, what is the pathway for changing into other specialty or GP training? Obviously, any degree and in any specialty will add knowledge when you work as a GP, and any knowledge would be useful for a GP. But you have to apply as like everyone as through the scratch again, because the other specialties or let's say other degrees won't work. But if you are trainee doctor in UK, if you are training in suppose let's say medicine or obs-gynae, there are some of the specialties which they consider. So if you're already in training and you want to change to GP training, then they might consider reducing the 6 months in the GP training. So that's one of the options as well. And the next question, how GP surgery is different than GP regular? Even I was confused when I came to UK first. Why are they calling GP surgery rather than just GP or GP clinic? But then the surgery means, I mean, of course, we know what surgery is, where they do surgical procedure, but there is another meaning for surgery as well, which means a clinic. So, but in UK, they like to use this word GP surgery rather than GP clinic, but it is no different than any other regular GP. They may or may not do some surgeries like minor surgery in GP, they can do, but still even if they don't do, they are still called GP surgery. And that's same as GP, normal GP regular. And after being GP, what can be done for further study? So Jolisha has already mentioned about the different roles you can do. So there are a GP with special interest. You can do a diploma in your interested field, like diploma in obs-gynae, diploma in dermatology, and you can have your own clinic in that specialty in a community. So you can do those. And if you have previous experience, like we've seen many of the suppose surgical trainees, they have good exposure in surgery. And once they become GP, they can open their own clinic to do some minor surgery in the community. So there are quite few options and roles, and depending on your experience and your degree, you can just do anything in GP land in the community. There are lots of scopes. So don't worry about you'll just be stuck inside the room doing a consultation with the patient. You can do so many things after becoming a GP. It's all your wish and choice. Yeah, I think, thank you. That's my presentation. And if any other question, we'll be happy to answer, me and Jolisha.
Yeah. Will Tulsi, well done, really well done. I think that was an overview of how to apply for a GP in UK. I think it's worth it to applying for a GP. You have to go through that long process, but at the end of the day, we can see from Jolisha's presentation and your presentation is really worth it. A difficult pathway, but I think at the end of the tunnel, you can see quite a bright light. Okay. There are a few questions on the floor, but I think Anang has managed to answer a few of them. And there were also people asking how to apply for ophthalmology and how to apply for psychiatry. I think you can apply through the same process as you apply for a GP. So that's really good. Kamal Dai has raised a hand. Do you want to say something, Kamal Dai?
Thank you, Ashish, Jolisha, and Tulsi for your wonderful presentations. Very informative, very useful. I just wanted to clarify around the CREST bit. So the CREST, if you are on a non-training post, you need to do those forms which are similar to F2 competencies in a way. And can you, as a trust grade post, sometimes what I call my trainees is you still maintain that F2 competencies are do the paper form. So which one is better to tell them then? Yeah.
So sorry, CREST form itself is a paper form you download from the website or let's say the internet. And it's a paper form, and you can look into the competencies. and work out with the consultant you are closely working with, and work on those capabilities or competencies which you haven't fulfilled, or if you have already fulfilled, you can just tick it off. You will be happy to tick it off.
Is that going to be for if you are going to apply for GP or for other specialties as well?
I think it's the same CREST form for every specialty. For all the
specialties. Yeah. That's good. Okay, thank you.
If I may add a few bits on that one,
yeah.
So what the guideline says, you're right, we can have the online version as well, but what guideline says is for every online evidence, you need to have hard paper evidence for everything. So that means it has to be done physically, and then you can try on otherwise. Yeah.
And the next bit, I just want to...
sorry, I would also like to add that it might seem like a lengthy process, but I want to reassure you guys, it's simpler than that. All you have to do is make sure that your consultant who's going to sign you know that this is what you're looking forward to. And as a doctor, you'll be seeing patients day in and day out. So these forms do get filled quicker than you think. I did the same thing, and it didn't cost me a lot of energy or effort. So do not despair if you think that it's a long process. It's really not. It's just you have to be working on it every day. It takes 5 minutes really. So it's not all doom and gloom. So yeah, don't let that deter you. It's going to be very simple.
Thank you. You need to make a habit here. Then it becomes very easy. So the next bit, if somebody has done, there is a question in the chat. If somebody has done MRCRS or MRCOG, if you have got a UK training on different specialities, 6 months of that can be counted to reduce the training from 3 years. That is my understanding. But you still need to do the usual entrance examination and the requirements you need to go through.
Yes, that's right.
Yeah, thank you. That's all I have here. Thank you, Ashish.
Thank you, Kamal. I think really good presentation. I think discussion will continue throughout. And if people have any further queries, they can contact our speaker or our NDA. We'll also post the video in our Facebook page, so hopefully people can watch it, and YouTube also. And now I would like to request Anang, who is a specialty doctor, and he's working in a hospital. He did his MBBS from Tribhuvan University and did a MS from BPKIHS Tehran. There's furthermore question on the floor, but we'll ask them, we'll answer them at the end. Anang, do you want to take the floor?
Namaste and good morning. I'm Anang. I am working currently as a specialty doctor in general surgery department, and I'll be talking on how it is to be a specialty doctor in the UK. So let's talk about what specialty doctors are. The doctors who generally work within one specialty, always in the secondary or tertiary hospitals under the supervision of one or more consultants. These doctors, the specialty doctors, are neither training doctors, or they are not a consultant as well. So they are also called middle grade doctors. They are working under the supervision of some consultant. So as a specialty doctor is not a training pathway. Those people who have got quite a bit of experience in their field, at least 4 years, and 2 of those being in relevant specialties such as general surgery, they can work as a specialty doctor. They range in their experience from various skills and experience. They do have some autonomy based upon the level of experience and skills, and usually work under the consultants. Basically, this post can be considered as a work, as a job where you are expected to be a service provider, where you run theaters, you do emergency works, you look after the ward, and also you run clinics under the supervision of your consultant. So how I became a specialty doctor, I passed my master's degree from BPKIHS and had a at least 3 or 4 years of academic practice in a university and a tertiary hospital. And then I decided to take MRCS exam for my full GMC registration back in 2018. And then I applied for this job. After successful application and interviews, I joined the East Kent Hospital back in 2019 as a specialty doctor in the first year, where the contract was for only 1 year, which was reviewed later. And then now I'm working as a permanent employee after a review. So what I'm doing now is trying to focus on my career, preparing for the FRCS exams. I'm working on research, audit, and also take part in teaching activities, academic activities as well, behind all the background of clinical jobs that that a doctor is expected to do at our level. So what are the benefits of joining as a specialty doctor? You do not have to travel a lot. You have a fixed job in a fixed place. This is quite different from training. Those who are in training pathway, they do have to change and shift to different hospitals for their specialty trainings. You do enjoy some form of autonomy if you are skilled, if you do have experience based upon that is provided by the consultants or your supervisors. Though it is not a training pathway, your training actually continues unofficially. You do get funds for national courses. You do get support for CESR application. That application is a pathway to become a consultant, which Mr. Shrestha will soon talk about. You do enjoy quite a lot of annual leaves and other facilities. I do get 32 days of annual leave per year. And it's a permanent job with all the exciting features of pension and all after this job is over. You also get study leaves of at least 10 days in a year. You can take up to 30 days in 3 years' time. And depending, as Jolisha mentioned, it is a bit flexible. The job plan, you can modify your way of working. A minimum of 8 to 5 job is done as expected, but you can also set out time for other academic activities. You can join MSc courses and other of your interest. And if you do have unexpected situations, parental commitments, or other forms of commitment, you can also arrange for unpaid leave. So it's quite a flexible thing to do. In terms of finances, is enough, is pretty good. However, we have to consider that living expenses are higher than back home. So the flexibility probably has given me the chances of going all around the UK last year. And I have enjoyed various parts of the country traveling. Not as in the amount as Jolisha has done, but you do have such a facility. So some downsides: when I came to UK, I was a assistant professor back in Nepal. I was at the level of a consultant there. When I joined in a different level. It is a bit different. You are not a consultant in here. You work under the consultant fully. You do not enjoy the full autonomy here as you do at your level. However, it is still enjoyable. It is quite a learning opportunity. And as I would mention, I came here to learn about advanced laparoscopic skills and all. And my skill level, my learning has certainly gone beyond what I actually expected. So it takes time and patience to cope in a different complex system, which is quite different from what we have got in our country back home. It is not a training pathway, so there is no structured path to attain a consultant position or your goals. So you have to be working very hard on your portfolio, your logbooks, and logbooks, including ISCP. You have to keep on working on your publications, joining meetings, conferences, seminars, etc. On an unstructured way. Basically, what I mean to say is you have to work on your own path without a structured way. And there is a risk that if you don't set your goals, you might become stagnant in the job, and you keep on doing things routinely. So what are the options for a specialty doctor? You can progress in your career from SHO to registrar, and then if you are not in a training pathway, still there is an option of being a consultant through CESR pathway. The other option is you continue to work as a specialty grade doctor or associate specialist, which is not the consultant, but works autonomously in that pathway. The other option is, after gaining a lot of knowledge and skills in the job, you can actually go back home and practice more advanced in a more advanced way back home. So why you want to come to UK? There may be many thousand reasons, but what I want to enlist is it's full of opportunities. You dwell into a lot of research. If you are interested in, you can go through a lot of specialties and sub-specialties if you like to. And there are hundreds of routes to work, hundreds of routes to work in the UK. You can go into the training pathway as well. And a bit different training philosophy we have got here. That is one of the striking things I have found. We have got a didactic type of lecturing and training back home, whereas here you set your goals, you attempt, achieve, and you reflect upon yourself, and you keep on learning. Only one advice I would like to give is if you want to come to UK and try getting into a specialty training, or want to gain experience, join early in your career, because I have found that year of graduation actually matters in some specialities for the training. Thank you.
Well done, Anang. That was really good, short and sweet presentation. For the others, especially from Nepal, I think specialty doctors are the backbone of our department. They are quite experienced people. We rely on them, and there's some they can do some autonomous practice also. Anang at the same time is doing a master's program in from the Royal College of Edinburgh, for University of Edinburgh. Am I right, Anang?
Yeah.
That's really good, and it provides a lot of opportunities at the same time. Yes, there's an option of being at the same like position like specialty grade doctor for a long time. People even retire with that. People are so happy with that. They sacrifice their career, to become a specialty doctor. Other option is to become an associate specialist, slightly higher than a specialty doctor, but slightly less than consultant post. But it's like working as a junior consultant. So there's another option of going through that route. Other option is to go for the consultant post. So well done, Anang. I think that was a really good presentation. So we leave the questions at the end of this my presentation, and we'll take it from there. And I can see that where Anang is, I was probably 5 years ago in the same position. Okay, I think what I've done and what the NDA is trying to do is that provide a people overview of the career pathway they can take. As you can see, there's a non-training program. Training programs doesn't mean that I'm like, if you're not non-trainee, you can't be, you can't progress in a career. You can. Okay, so I'd like to share my slide, and then I'll start my presentation. Can you see my presentation? Anang, can you see my presentation here? Okay,
yeah,
so application for CESR, which is a certificate of eligibility for specialty registration. I'm a colorectal surgeon at William Harvey Hospital, and I took a non-training route. Difficult, but at the end of the day, it did pay. Now, I'll take you through my journey through CESR, the application process, and how to organize evidence. And especially, I will be concentrating on people who want to apply for a general surgical specialty. What are the criteria they need to fulfill in order to get the approval for the CESR? Probably a few of my colleagues will relate to my career, my journey while I came to UK. I came to UK in 2005. I started my clinical attachment from Royal in Edinburgh Royal Infirmary. Tough time. Didn't have enough money. But I'm like, to improve my portfolio, I did a clinical attachment there. Then I got a job in Dumfries, where I did a SHO work for nearly 2 years, SHO to junior register job for nearly 2 years. I was a bit relaxed at that time because I got a job, I got a place to work, and I didn't have to worry about money, and I was enjoying life. I didn't bother about my career at that time. But later on, when I saw my juniors going ahead of me, then I decided to progress with my career. Then I came to Royal Marsden in London, where I did a fellowship, a kind of research job, where I got a lot of experience in research, and I managed to produce some paper. Following that, I did a clinical fellow job in somewhere in Suffolk, and that really improved my portfolio. But having said, there was a difficult time. Every time, to get a training job, you need to have a visa, proper visa. If you don't have a proper visa, then you won't get the training job at all. Following that, luckily I got a job in William Harvey Hospital, but I left my job for a year to do my master degree in Imperial College London. Following that, it was probably around 2013, and I did manage to get a training job in Northern Ireland, but my family were in London, and I had a small boy, so I didn't want to leave them. So I decided to follow the career for to progress and to apply for a CESR. So prospectively, which was really easy to do, and I started collecting evidence for my CESR. The only thing that puts you back when you're applying for a CESR post is your FRCS examination. So you need to pass the exams, you need to be eligible for CESR application. Okay, so that's why I passed my FRCS in 2017. And following that, I've been working as a locum consultant, and then I got a substantive post after my CESR application getting approved in 2020. So as you can see, it's a difficult path, but at the end of the day, you will be able to achieve something at the end of the day. And that taught me a lot of lessons at the time. And now I'm working as a colorectal consultant surgeon at William Harvey Hospital. This is William Harvey. It's a 730-bedded hospital. William Harvey is the person who describes circulation of the blood. It's quite a busy district general hospital and level 2 trauma center. So why did I choose CESR? Because I did my part of my training in Nepal. So I nearly worked in Biro Hospital for nearly 3 years. I was probably overqualified by the time I was ready for ST3 application. And I did try 2 or 3 times, and I was not successful in getting a specialty training. Although I did get at the very end, but I decided to choose the pathway for CESR. My colleagues were on the same boat at the time. Somebody went to do a master's in research, who got a MD in research, and somebody went for a training post. But having said that, I got into consultant post slightly earlier than them. So if somebody is planning to apply for a CESR, I think they are not alone. So don't despair. Why CESR then? You'll get your registration into GMC. That means you can apply for a substantive post following that. Your name will be there, your registration will be there. So there's a various way you can do get the registration. I'm like, that's one is through proper training program, and the other through CESRs. There's also combined CESR program, and which includes part training and part doing the non-training job. So we are probably going through route 2 if you are going to apply for a CESR. And the easiest way out, as Anang said, if you come early in your career, is route 1. So route 1, you usually can get into the training, and you had a set program, everything's set out for you. But if you're planning to go through for CESRs, you're going to work as a specialty doctor or non-training doctor, but you have to set your own program. You have to have a target. You have to have objectives. Nobody is going to help you. It's you yourself who's setting the program, who's setting the, who's collecting the evidence and so on. But you need to follow the curriculum that the people in this specialty are following. And even you can get a specialist registration for GP and for various specialty. So how does the application process start? If you feel that you're ready, you start submitting your application. That means you gather evidence. Nowadays, really easy because you can do it online. You can load the evidence online. Once you are ready, the GMC will send your application to the Royal College, and the Royal College will evaluate your evidence. Following that evaluation of your evidence, the Royal College will decide whether you have enough evidence to become a consultant. That means they are really looking for people who can do a job on the day one as a consultant. If you get approval, then that you are in the GMC registration, in the specialist registration. If you don't, then they'll give you at least 1 year to gather all the evidence that you have or get some more experience that you have. And then they'll send that application again to Royal Colleges. If you don't, if you even fail that second time, then you can appeal or you can reapply or just leave it as it is. Now, outcome of the CESR application is, if you look at it, it's not difficult, but at the same time, it's not easy. In general surgery, the success rate was nearly around 44%. When I applied, there was 17 candidates who applied for the CESR, but I was the only one who got it. So it was 8% success rate at the time. Anesthesia, slightly higher. The good one is the people who registered were asking about ophthalmology and radiology. I think the success rate for them is slightly higher than compared to the other ones. Now, more than 50% applicants are successful for getting the CCT. With regards to surgery, I think there is 2 curriculum. One is 2018 curriculum and the other one is 2021. People can still apply for the CESR post using 2018 criteria. And people who want to apply from now on, they can also go through the 2021 curriculum, but the application process, that evidence that you have to provide is slightly different. So what is GMC looking for? GMC is looking for what how you do a good medical practice. What is good medical practice? That means you have enough knowledge, skills, and performance to become a consultant. You have to be safe, and the quality of service that provide should be good. You should have good communication with patient, family, everybody around it. There are a lot of people who works with you. You need to have good communication and teamwork with them. And the most important thing is a trust. Never lie to GMC and never say anything that's put evidence that you can't show. Okay, if you lie to GMC, you won't be taken out from the GMC registration. So you have to be really careful on what evidence you provide and so on. So you have to gather all the evidence that in the domain for good medical practice from GMC. So these are the domains, the 4 domains, that's really important. Okay. Now, in the part 1, you need to choose the specialty. Like if you want to go for general surgery with colorectal interest, then you have to choose that specialty. There are other specialty you can also choose for, and there's no limit of specialty that you can choose for, but you need to be able to show the evidence. A curriculum vitae, it's like doing a window shopping. So if you want to do window shopping, then you need to find out what products to buy. If you make a curriculum vitae so obvious, like that one person can read it so easily and find all the evidence relating to that, then I'm like the people who are reviewing your application will be really happy to go through it, and the success rate is slightly higher. So CV, writing a good CV is really important. With regards to employment, job description, and job plan, you need to ensure that you have worked in different specialty. You have trained as this other trainee does, who is applying for a CCT, and you have to show the length and breadth of curriculum that you have covered with the job that you have done. And the on-call rota is really important because it gives them, you can give them evidence of emergency work you have done. With regards to primary medical qualification, most of the medical qualification from Nepal is recognized. Some people have asked on the registration that whether the MS is recognized. I don't think it's recognized, but yes, the experience they have will be recognized. And try to keep evidence of honor and prizes that you have won in the past. Okay, so it's always easier if you start collecting the evidence now rather than later. If you come here and start collecting all the evidence that you have done in Nepal, then it's really tough. Sometimes you might be able to do that, but you have to work hard on it. So the part 2 is about showing evidence about knowledge, skills, and experience. Unless you pass a FRCSEd exam, you won't be able to apply for the CESR. They'll outright reject your application. There's also FRCS International. It's not an intercollegiate specialty board exams, so you need to be really careful. I've advised people in the past not to give the exams. Yes, if you want to get some degrees and you want to have some, if you want to work in Nepal, that's fine. I'm like, or anywhere else, they'll recognize that degree. But here in UK, they don't recognize international FRCS. With regards to skills and experience, you should be able to show what the curriculum says. You need to have a clinical experience. That means whenever the trainees here goes for a training, they do foundation year program, core surgical training, and they'll go into a specialty. In the specialty training, it starts from ST3 and it goes up to ST8. In the initial 3 or 4 years, they have to cover length and breadth experience, have experience on emergency surgery and different other specialty. But on the final 2 years, they have to choose a specialty they want to go, and alongside with it, you have to have emergency surgical experience. So you should be able to show this evidence. In UK, we have work-based assessment. It's really important. We have something called case-based discussion. We have to, and problem-based assessment. You have to use those forms or use those assessment to show that you have all the experience in critical condition, how to manage a patient with a very sick patient or a patient with acute surgical condition. You should be able to use your logbook to show your operative experience. And there are certain numbers that you need to show the competence if you're applying for a certain specialty. So let's say you want to apply for a general surgery with a special interest in colorectal surgery. You need to be able to show that you have done 1,600 procedures in 6 years. That means you should be able to do, you should show that you should be able to do nearly about 260 procedures per year. It's difficult, but it's achievable. And the numbers are the indicative numbers that's really required to get into the CESR application, to get approval. You can see the list of operation and the numbers of procedure that's required. For colorectal surgery, that's something people struggle. You might be able to get all the numbers that's provided in emergency general surgery, but if you want to apply for colorectal surgery, you have to come and work here in UK at least 2 to 3 years to get those numbers, especially in low anterior resection and the segmental colectomies. Recently, for the 2021 curriculum, you should have 200 colonoscopy, to get that evidence, so that it's approved by the review board in Royal College. And you need to have this competency based on your work-based assessment. Should be level 4. That means you should be able to perform this procedure independently. And yes, there should be 3 consultants, separate consultant, who should be able to provide the evidence for you if you have done this procedure. Now, organizing your evidence is sometimes difficult, but you should organize in such a way it's easier for the reviewer to go through. Rather than putting a separate evidence, try to put it in a group that you are looking for. Like if you're providing to show your operative experience, then you should show them in the following categories, okay, on the following folders and subfolders. What else? The mandatory course that you have to attend are this one. That means you should be able to do, you should do this course, to get all the criteria that you need for the application. Research. With regards to research, either if you have a research degree, it's good and fine. But if you don't have a research degree, you should show evidence of presenting papers, or if your involvement in any research collaborative study or authorship in paper. That you can even start from Nepal, and people have publication from Nepal which can be useful when you're applying for CESR. Medical education and training. This is to see and understand how good you are as a teacher. So there are certain courses that you have to do, like train the trainers or equivalent, or the feedback is really important. And taking a feedback, having a lecture site there, don't delete it from your file, keep it always there. Teaching timetables are really important to show as evidence. Audit and quality improvement projects. And those are the other things that you also need to qualify for. You need at least 3 audits in 6 years' time, and you should be able to complete 1 cycle of the audit. And you can show the evidence based on different categories. You can show it as a slides or the audit reports and so on. Management and leadership. If you have done any leadership course, put it as evidence. If you have done any role, like even like rota management, or you've organized an event, or you have chaired a meeting like MDT meetings, or chaired a meeting in different ways. So put that as evidence. Even the minutes of those meetings can be helpful. There are a host of evidence that you have to show to GMC. We do what you call an appraisal every year, and you have to show at least 3 appraisal done in last 6 years. Communication with the patient, communication with the family, communication with the colleagues, communication with the multidisciplinary team are also important. I've listed all the evidence on the right-hand side that you can provide. We will send this slides to you if somebody requests for it. And you can see there's quite a lot of evidence that you have to collect in last 6 years. The more recent the evidence are, the more better it is. And the reviewer will think that you're continuing to do that, and they'll take that into account. And there are other evidence that you can provide in the form of consent. You have to show that you are progressing well. I think Nepal has started this CPD points. That means it's about your professional development. If you show those evidence that you're progressing in your career and you're doing everything to train yourself and keeping up to date with the evidence, then that's good enough. There are also other mandatory stuff that you have to do. That's about the clinical governance, data protection, and so on. We'll provide you with this slide, so hopefully that can be useful. And you can also get this information from our GMC website. More, I've already talked about leadership and management. Multi-source feedback is something that you have to do. We do regularly here in UK. So if you provide at least one in last 6 years, that'd be enough. The most important point is that you need to reflect on what you have done. As Anang has told before, reflection is really important. If you write it down somewhere, and if you write a reflection and show your evidence, one of the evidence as a reflection to every category, that means you provide evidence on those category, and that can be really useful. The other evidence that you have to provide is with regards to probity. And as I told you before, reflection is really important. But recently, the application process, if you want to apply for a 2021 curriculum, is a bit different. You have to show that you have capabilities in practice in the form of outpatient, whether you can manage outpatient clinic or not, your operating list, and the multidisciplinary team meeting. So this will be assessed through what we call a multiple consultant reporting system. So it's quite a new thing that we have started here in UK, but it's really important to provide this evidence, you know, to get into getting successful in CESR application. Same thing is a part 4 is the same thing I've repeated above, but you have to provide those evidence in those domain using the MCR, that means multiple consultant reporting system. So top tips, as mentioned before, always group evidence. You should not have more than 100 pages, 1,000 pages as shown as evidence. Don't duplicate things. That means you can cross-reference using the documents that you have and the folders that you have. If you're having evidence verified is really important. You need to ensure that the evidence that you provided can be verified. So let's say you provide evidence from Nepal and you can't get a verification, then it's difficult. You have to have it verified early on, or you need to find a way to have it verified. You will always have an advisor who will advise you every time when you're applying for this post, when you're loading your evidence. After you have paid your application fee, that's nearly around £1,600, but it's worth it if it's approved, your application is approved, it's worth it. But yes, always listen to your advisor, and make sure that your evidence is anonymized, like patient details, the address, details of your colleagues. You should not put them on as evidence at all. Putting this evidence, having this evidence is quite a lot. It's quite a lot. It nearly takes you about a year to gather evidence, put it on the folder. I started my application process in late 2018, and I managed to submit that in 2019. Quite a long process. Your room will be filled with all your hard evidence that you have to scan and load it in the system. It's difficult, but it's doable. And as you can see, there's a 50% success rate in general surgery if you do it properly. Okay, so having said that, in a CV, it's not about all the evidence that you have shown. It's not about the academic stuff. If you write that something you have done in the past, or like extracurricular activities, it's good. It's good. I did this trip Annapurna circuit in 2017 after passing my FRCS, and I do love Nepal. My heart is in Nepal, but although I'm here, yes, hopefully, conducting this webinar is a way of giving something to Nepal. And I did go with quite a few colleagues from Pokhara. They're all doctors. Some of them are ENT surgeons. There's my brother there who's a radiologist. People have been asking me, do you earn more money in UK or more money in Nepal? I think nowadays you can earn more money in Nepal than in UK. And you can see at the bottom is a Tulsi lake in the background. Thank you.
Wonderful, Ashish. Thank you very much. Ended with those beautiful pictures. So we'll come towards wrapping. If you have any questions, you can raise your hand. So I'll try towards summarization. Before I do that, if everybody is okay, I want you to put your cameras on so that I can take a screenshot if you are okay with that. If you put your pictures on, then I can take a screenshot, which we can use to take a picture if that is okay with you. So I'll just go to the next one. So that is 20. Everybody has come here, looks like. Sorry, I'll just take this one off actually. Chat. So one more if I can take. So this is nearly 2 hours. We had a lot of information, so I just want to summarize and I want to say a few words on behalf of NDA-Uk, then we'll be closing. So 2 things I thought we tried to cover today was about GP training and the other one about the CESR and the specialty training route, specialty doctor type of posts and what they mean, because many of us, if you are coming from overseas, we are we have not done our medical school here, and sometimes we find a bit difficult to go on the mainstream, and specialty doctor may be one of the posts many of us take. And when we take that, it is not the end. So it's evident from here, Mr. Ashish Shrestha has shown you, he has become a consultant, which is the aim of every doctor anyway. So you don't need to be on that structured training pathway. You can become a consultant, even if you are a specialty doctor. But what I learned from that was you need to collect your evidence. You need to keep on working hard. You need to keep on doing additional degrees and researches, and then you can reach the top. So about collecting evidence, don't do it retrospectively. You collect it prospectively so that the things become much more easier. Anang's post there, what I remembered was there are some of my friends who have not come to the structured training pathway, even if they tried or they have not wanted to try to apply for that, because you have to rotate so many different hospitals. You see, if you are on the structured specialty training, for example, in surgery or medicine or any other specialty, then you have to travel so many different hospitals in one region, and then you keep on moving every year. So that makes it very difficult, especially if you have a family which is with children. And Ashish rightly said, he had to move to Northern Ireland if you wanted to get that specialty training post, the structural training post. So it's not and whereas remaining as a specialty doctor, middle grade in one hospital, it has got a more long term and you don't need to keep on moving, and that sort of a stress is less. But still you can do the exams and you can be on the specialist register. So that is about the last 2, but the first 2, I really enjoyed Jolisha's point about the GP, as I thought it is one of the best jobs, actually, with good work-life balance. I was particularly touched about how the patients are treated in UK compared with Nepal, because when I went to do my interview for the laparoscopic colorectal fellowship in Dundee. So that is what they said. So, oh, you have come from Nepal. What is it? What is the difference between Nepal and here? That is exactly what I said. Patients here are treated with dignity and respect. So that is what it is. And that is something we need to do everywhere. That is something which NHS and the UK is proud about. Regarding Tulsi's presentation, very nicely done about the requisites, what we need to do to become a GP, and then the exams. The ALS course he mentioned about, it's not only for the GP, but for every doctor who works in the hospital. If it is your first job, make sure you book that ALS course, because that gives you a structured way in how to assess any patient, either medical or surgical, so that that is also requisite to do anything else in the future as well. So when we were sort of training, one of the problems was if you are coming for overseas, the visa was to be the hurdle. Maybe that is still the hurdle, hopefully less though, because if you are on a visa program compared with the permanent residency, then you are treated as a second class. So even if you are good, then you didn't get the job, but hopefully that problem is a bit less. But the success, the recipe for success, what I have learned is keep on trying, don't give up, and look into what is required. And if you go according to what they have required and keep on practicing, I'm sure you'll reach whatever you want to do. And lastly, Ashish's point, one point it reminded me about working as a doctor, and if you want to succeed again. So those 3 points: knowledge, skills, and behavior. That is very important. That means you have got good knowledge, you have passed your exams, and you have done CPDs, so that you are good unto that. You have got practical skills, including surgical skills. You can do those operations. You have got competency to do that. You have got good behavior. You are working with your colleagues well. You have got nice feedback. You don't have much complaints. You have got a lot of compliments. So that sort of thing is there. But in addition to those 3 things, there are certain things you must have, and that is teaching and training, making sure you are involved into those, and you have got evidence onto that. You are involved in research and audit. You keep on doing that, and publishing. So that is something you need to keep on doing. And you have got good leadership and management roles, good communication skills. So those sort of things is there. And rightly, as is told, even though you may not have a management role, but just getting involved in the rota, for example, or organizing any events, for example. So those may be some of the things you can do. So NDA-Uk, so with this, please join NDA-Uk. That gives you opportunity to get involved in the leadership and management activities. Become member. You can come to the executive committee. You will have develop opportunities and skills to work as a team. So organizing different things. So that helps you to develop into that. With this, lastly, I just want to share my slide about NDA-Uk a little bit, if that is okay, because I'm the NDA-Uk president. Without telling anything about the NDA-Uk doesn't finish my presentation. So one of the things I have tried to make sure is making NDA-Uk more visible, and making sure we do something for each other. So Nepalese Doctors Association UK, this was established 1985, long time ago, and we are very grateful to our seniors who established this organization where we can follow. It was established with different aims, but what it comes out is at the bottom. It is about the Nepalese doctors and other healthcare professionals who have love towards our motherland, and Ashish mentioned about that. And we are doing all this because we love our motherland, the Janani Janmabhumischa Swargadapi Gariyasi. We have good relationships with the Royal Nepalese Embassy in London, Nepalese Embassy, London. I just want to say what we do, what we have been doing, and where we want to go. So this 3-day event, which is held in July, Nepalese doctors who are residing in UK and their families, 3-day event, weekend, Friday, Saturday, Sunday, last weekend in July, AGM, wonderful event. So when many of you are here in UK, you must attend this. And those who are in Nepal but are planning to come to UK, when you have got job and are come here, please join this event. We do a lot of charitable activities, as you can see here, this A&M scholarship. We raised some money, Sumindrapun, then she has been helping these different scholarship programs. Dr. Ramesh Koju, our immediate past president, different birthing centers, different training programs. Due to lack of time, I won't be able to explain in detail. So there are anesthetic colleagues going on, doing some training programs here, myself, this laparoscopic surgery course and human factors workshop, all those things we have been doing. Not that we go and teach, we also learn from these courses actually. We have wonderful relationships with the Royal College of Surgeons of Edinburgh, and we are very grateful for their support. And we have been publishing as well to what we have been doing. During COVID times, it has been very difficult, and we have been able to be part of these difficulties with our brothers and sisters in Nepal, trying to help on different things on the way we can. It may not be a big thing, but even a small thing helps, including this 88-bedded Radhaswamy Field Hospital in Kathmandu. We were able to contribute some. So then what it is that we want to do as a NDA-UK, we want to increase the membership. Those who have got job in the UK, whatever grade you are in, we want you to join. The membership fee is just about 50 pounds a year, so 60 pounds a year, so £5 a month. So it's not much. It increases your ownership. You become the part of this organization, please join. And then you can come to the executive committee and become the part of the management team, and the management skills, leadership skills will be improved. So we are holding the charity dinner on the 2nd of April, which is there. A lot of benefits through the membership. I want to invite you, if you are in UK and working here, please join this charity event. So we were able to build 2 school buildings following massive earthquake in Nepal in 2015. So one of the schools we want to help to set up the library and the science lab, and then it will be a wonderful opportunity to catch up and to meet up with each other, which we have not been able to do over the last 2 years. The best-selling surgeon, senior neurosurgeon, Mr. Henry Mars will be there, who has written this book. Many of you may have read this, Do No Harm. He used to go to Nepal every year, and we are very grateful for him. And he used to be late Upendra Dev Kota's friend, whom we miss very much, and who he has trained all of us, many of us, including myself. So with this, I would like to welcome you again and say many thank you for this wonderful webinar. We have recorded it. We will put it on the NDA-UK website. Prajwal is here. I have the YouTube, and it will be useful for later viewing, I hope. Again, I want to thank all the speakers and all the delegates. Thank you again. So I will